my name is Amanda Cabajal, and I'm here to talk to you about my work. My work is titled Characterizing Uropathogenic E. coli, or UPEC, Antibiotic Resistance, Conferring Mutations and Effects on Drug-Binding Interactions of Fluoroquinolones. And I'm doing this work here at University of California, Santa Cruz, and my advisor is Manel Camps, PhD. And so uropathogenic E. coli, or UPEC, is a critical threat pathogen according to the World Health Organization. And this is because it's one of the most common infections that a human can get. If you've ever had a urinary tract infection, then you've had UPEC. Anyone can acquire UPEC, and it is the second most common nosocomial infection, which means that this is a very common infection that you can pick up in the clinical or hospital setting whenever a catheter is involved. A catheter may be inserted or removed from the urethra, and it's through this pathway that UPEC may sneak its way in there. And so, if left untreated, it may travel up through the bladder into the kidney, where here, if it's still untreated, it can hitch a ride in the renal artery, causing sepsis, which is a globalized problem when you have a bacterial infection in the bloodstream. It is very hard to treat this. And so, antibiotic resistance, as we know, we have heard, is a huge worldwide problem. So if you have UPEC or any other type of bacterial pathogen, there's a reason to be concerned if our drugs simply don't work anymore. In fact, it's estimated that if nobody is able to do something to change practices and improve the antibiotic design of the next generation of drugs, more people will die from antibiotic-resistant superbugs than all cancers combined by the year 2050. In order to combat this, I study the mechanisms of antibiotic resistance, specifically the modification of a drug target. And so what does that mean here? So that means I'm looking at these two enzymes here known as DNA gyrase and topoisomerase 4, and I look at how mutations are able to change their topography so that drugs are no longer able to bind to them since they've been altered in some way, shape, or form. I seek to figure out all the ways, all the shapes, and all the forms with respect to all of the unique mutations that exist in clinical samples that I have access to, as well as the whole genome sequencing data. And so altogether, there are many impacts that this data can have, not just for my pathogen, but my workflow can be used for other bacterial pathogens as well. And so not only that, with technology, we're able to derive better tools for modeling, such as modeling drug binding affinities in different types of drug targets. We can also improve clinical protocols, of course, understand QRDR mutations, which is the name for the quinolone-resistant determining region mutations I'm studying, as well as molecular modeling, novel antibiotic design, and exploring non-QRDR mutations and their effects. Thank you so much for your support and your attention. I really appreciate all of your help, and I'm excited for you to hear about my work. Thank you.